Hi, welcome back to the School of Social Work vlog series. My name is Amie Martin, and I'm placed with a maternal mental health specialist in private practice. This week, I wanted to talk a little bit more about my passion for moms and babies, or families and babies. This passion was born out of my experience working in child welfare services, domestic violence shelters, and a dual diagnosis treatment clinic where moms and their children remained together while they were in treatment for substance use and mental health disorders. When I took a break from social work and became a mother myself, I wanted to also keep up another passion of mine, which was dance. So I started teaching a dance class. While I selfishly wanted to just dance, I also needed to bring my baby, so I wore her and called it baby wearing dance. However, my social work brain, my maternal instincts quickly just lit up when I saw and felt the connection between movement, wearing my baby, listening to music, and wondered more about the mental health and my child's development. Wondering how all those played together. So this is when I knew I needed to learn more. I certified in baby wearing dance with Groover Dance, and I got certified in perinatal mood and anxiety disorders, and then also applied to grad school at the University of Alabama. Having so many passions and experience in several different areas of social work, I have always appreciated the opportunity to choose topics that we wanted to focus on for some of our assignments. For example, in research-informed practice in Social Work 570, we completed an assignment to help us be better consumers of research for research practice purposes. This class helped me look at the population that I'm interested in and help me ask those important questions about how this population's affected, what led up to the problem, the impact of not treating the problem, and creating a literature review. This literature review really helped me develop my specific interest, not just in maternal mental health or parental mental health, but looking at the mother-infant relationship. I am excited to see more research on this topic in the last few years. It really helped me understand what I was seeing and experiencing in my baby wearing dance classes. Research actually came out after I took that class, that class really helped me keep diving in and looking into what is out there and what they're saying and how that might benefit moms and babies. So through my research, training, and my internship, I'm learning a lot more about perinatal mood and anxiety disorders, what they are, the rate that they're happening, also complicating factors such as substance abuse or substance use, abuse and trauma, birth trauma, then the stress and pandemic, isolation, all those things are affecting moms and fathers and looking at how they're being affected. So in my work in child welfare, I definitely saw how mental health and untreated mental health can have a great impact on the family. And so now I'm really excited to see something called social prescribing. In the UK and Canada, they are doing something called social prescribing, where primary care doctors can refer patients to creative activities such as art, music, dance, singing. And this is really exciting for my passion of teaching dance and music. Also, in the US, they are looking at interventions called mother-baby interaction therapy. This is something that is exciting to see that it's being researched in a topic that's showing that it's effective, and looking more at how that might affect the mother's mood, her self-esteem, her well-being, and how it really facilitates that mother-infant bond. So we're not just focusing on improving mom's mental health or improving dad's mental health, but just looking at that relationship between the mom and the baby, and looking at that family as a system, not just the mother, not just the baby. And so that's something social work, I've always been drawn to about social work, is how we look at the system not just the family, but then also their community, and the importance of creating community. We know that therapy and medication are very effective treatments for mom for perinatal mood and anxiety disorders, but how wonderful would it be to take that even further and focus on that parent-child relationship as well. So thank you for letting me share this week. I look forward to talking with you more again.